Ms. Mariam Jaffer. Question 2.
The Silver Generation Office SGO has deployed about 3,000 staff and volunteers as Silver Generation Ambassadors, SGAs, to proactively outreach to seniors. Since 2014, SGO has made over 1 million engagements. In 2019, SGO made 339,000 home visits. In 2020, SGO adapted their engagement approaches during the COVID-19 pandemic and made 140 home visits, complemented by an additional 140,000 home visits, complemented by an additional 140,000 telephone check-ins. In 2021, SGO pivoted to encouraging and assisting seniors' COVID-19 vaccinations, reaching out to 168,000 and 11,000 seniors through home visits and telephone check-ins, respectively.
Ms. Mariam Jaffer.
Given, I think a lot has been raised in this House, the concerns for the mental wellness of our elderly. And as the COVID pandemic drags on, I think it's been quite a while since some of them have had house visits. So can the Ministry also talk about the forward-looking plans? Will we bring the house visits back to about the level of 300,000, and when will that happen?
I thank Member for the question. Indeed, the COVID-19 pandemic has caused a shift in the way the Silver Generation Office outreach to the seniors. But I think we need to move forward, we also need to understand the genesis of the SGO. SGO, previously known as Pioneer Generation Office, was established to really reach out to pioneers relating to the PG package and to actually tell them about the various government schemes and MediShield as well as CHARS. And so when they also then evolved in April 2019 to merge with AIC, the expanded scope was then to reach to another bigger group. So it was initially a smaller group and it extended to a bigger group. And that was on Merdeka Generation Package. So in 2020, then it had to adjust and pivot to shift into doing house visits as well as also engagements to that particular group. And this is also something that we need to continue looking at. I understand the concerns because the elderly are at home and they're not able to engage. There are a lot of efforts that we're doing with other partners as well to make sure that this engagement continues. We recognize the mandate is now to go beyond just communicating government schemes to better address their needs in a more targeted manner. So we've actually been working with the regional health systems, clusters, primary care and community care partners to instill preventive health messaging and working with the community so that they can also augment the support and engagement that the SGO through the SGA have been giving. So we are hoping to actually continue to build on this relationship so that we can actually expand that effort and also look at targeting the areas, especially with more frequent visits to at-risk seniors, including those who are frail or have weak social support. And we are also enhancing the competency of the SGAs to engage our seniors more effectively so that they can continue to stay active and mentally engaged as well.